Hello and welcome. My name is Steve Hefferon, and I'm proud to present another featured video from the Healthy Back Institute. Today's topic is going to be on trigger point therapy. If you suffer from sciatica, herniated disc, spinal stenosis, strained muscles, pulled muscles, or failed back pain surgery of any type, you have trigger points. And what I'm about to tell you could change your life. With normal muscle movement, the muscles actually contract and relax, contract and relax. With the trigger point, the muscles actually get stuck, and that stuckness creates a tightness and a weakness in that particular muscle area. What we do in trigger point therapy is create a downward pressure or a direct pressure directly over the trigger point to break that mechanical bond. And so as we break it, we start to break up this mechanical connection. And over time, you can break it up and the muscle can return to normal strength and normal flexibility, improving mobility and decreasing pain. You can have repetitive use cause a trigger point. You can have trauma cause a trigger point, surgery, the condition itself. So understanding that all of these multiple factors that can cause a trigger point, and without addressing the trigger point, you may suffer for an extended period of time. Understanding that trigger points may last decades, if not a lifetime, if not addressed properly. One of the other things that you need to understand about trigger points is that there are actually three types. There's an active trigger point where if you put direct pressure down through it, you'll actually feel pain. There's referred trigger points where if you actually put pressure down through it, you'll feel it somewhere else. And then there are latent trigger points which don't actually cause pain but still cause tightness, weakness, and a restriction in the body's ability to make its proper movements. As I said earlier, trigger points cannot be exercised out, they cannot be stretched out, they need to be mechanically broken. As a massage therapist, I perform trigger point therapy on all of my patients. However, to get the best results, trigger point therapy needs to be performed on a daily, consistent basis. And the best way to do that is with a self-care system. We here at the Healthy Back Institute have searched long and hard to try and find a very simple but very effective self-treatment program, and we think we have done that. It's actually in this box. It's called the Trigger Point Self-Care System. The Trigger Point Self-Care System comes with a 6x18 board. It actually has multiple different holes that are in multiple different angles so that you can get at the trigger point with the best and most efficient angle. It comes with 16 different knobbies for the direct pressure. It comes with a workbook and a 90-minute DVD explaining how to identify your trigger points and what the best arrangement or configuration of the trigger point board is for each and every trigger point that's identifiable on the body. Now we're going to demonstrate how easy it is to use the self-treatment trigger point system. I actually have this configuration for the SI joint, and I'll place this in the middle of the bed for demonstration purposes. This can be done on the floor. I don't recommend it be done in your bed, but for demonstration purposes, we'll do it on this bed. And basically, when he lies on this, he'll lie with each knob on either side of the spine, just above the SI joint. And so now I'll ask him to get on. Now what he'll feel is not necessarily pain, but a pressure. And again, remember, trigger point therapy needs to be done daily, continuously, consistently, held for about 90 seconds. Now, as a basic treatment, you can stay in a static position. Latest research actually shows that a linear movement along the muscle, so I'll ask him to do a little bit of a movement or a rocking position along the muscle right over the trigger point, has been shown to be the absolute most effective way. So again, holding it for about 90 seconds, I'll ask him to roll off and then immediately go in to a stretch. So he'll be stretching his lower back.